Welcome to this informative video about Meralgia Paresthetica, a nerve condition that can cause tingling, numbness, and burning pain in your outer thigh. We'll explore what causes this condition, how it's diagnosed, and what you can do to find relief. Meralgia Paresthetica, also known as Bernhardt-Roth syndrome, is primarily caused by compression or entrapment of the lateral femoral cutaneous nerve. This nerve, which provides sensation to the skin on your outer thigh, travels from the spine, through the pelvis, and into the thigh. Several factors can lead to its compression. Common culprits include tight clothing, such as belts or skinny jeans, obesity, which increases pressure in the abdomen, pregnancy, due to weight gain and shifts in posture, and conditions like diabetes, which can damage nerves. Additionally, prolonged sitting or standing, repetitive leg movements, and even scar tissue from previous surgeries in the area can contribute to nerve compression. The pathophysiology of Meralgia Paresthetica centers around the lateral femoral cutaneous nerve being squeezed or pinched. When this nerve is compressed, its ability to transmit sensory signals to the brain is disrupted. This disruption results in the characteristic symptoms of the condition: tingling, numbness, burning pain, and sometimes sensitivity to touch in the affected area of the thigh. Prolonged compression can even lead to nerve damage, potentially making the symptoms more persistent. Meralgia paresthetica is a relatively common condition, although precise epidemiological data is limited. It affects people of all ages, but it's more frequently seen in middle-aged adults, especially those who are overweight or obese. Pregnant women also have an increased risk. Certain occupations that involve prolonged sitting or repetitive leg movements, as well as individuals with diabetes, are also more susceptible to developing Meralgia paresthetica. The hallmark signs and symptoms of Meralgia paresthetica are typically localized to the outer aspect of the thigh. Patients often describe a burning pain, tingling sensations, numbness, or a pins and needles feeling. These symptoms may be constant or intermittent, and they can be aggravated by standing, walking, or wearing tight clothing. While the condition is usually not associated with muscle weakness, the discomfort can significantly impact daily activities. Diagnosing Meralgia paresthetica often involves a thorough physical examination and review of your medical history. Your doctor will likely assess your sensation in the affected area and rule out other possible causes of your symptoms. Nerve conduction studies or electromyography (EMGA) may be performed to evaluate the function of the lateral femoral cutaneous nerve and exclude other nerve disorders. In some cases, imaging studies like an MRI may be ordered to rule out structural abnormalities that could be contributing to the nerve compression. Meralgia paresthetica doesn't typically have distinct classifications or types. The severity of symptoms can vary from mild and intermittent to chronic and debilitating, but the underlying cause remains the same: compression of the lateral femoral cutaneous nerve. The initial treatment for Meralgia paresthetica usually involves conservative measures aimed at relieving pressure on the nerve. This may include losing weight if overweight or obese, avoiding tight clothing, using a standing desk if you sit for long periods, and taking over the counter pain relievers like ibuprofen or acetaminophen. If these measures are not sufficient, your doctor may recommend prescription medications, such as nerve pain medications like gabapentin or pregabalin, or corticosteroid injections to reduce inflammation around the nerve. In rare cases, when conservative treatments fail to provide relief, surgery to release the compressed nerve may be considered. Preventing Meralgia paresthetica often involves lifestyle modifications to reduce risk factors. Maintaining a healthy weight, avoiding tight-fitting clothing, especially around the waist, and practicing good posture can all help. If your job requires prolonged sitting, take frequent breaks to stand and stretch. For those with diabetes, managing blood sugar levels can help prevent nerve damage. The prognosis for Meralgia paresthetica is generally good. In many cases, symptoms resolve with conservative treatment and lifestyle changes. However, if the nerve compression is severe or prolonged, symptoms may persist or recur. Ongoing research is exploring new approaches to nerve pain management, including minimally invasive surgical techniques and targeted therapies, which may offer hope for those with chronic or refractory cases of Meralgia paresthetica.